just in case, I want to take this moment to make sure listeners are aware that early bird pricing for my online yoga teacher training is available until October 1st. If you feel like you learned something from the show, or you connect with the way that I engage in these conversations, and you're looking for a learning opportunity to delve deeper into your own understanding of yoga, or develop a teaching practice, or maybe you already have a teaching practice and you're looking for new information, then my year-long program might be the perfect thing. A new group is starting in January, and I do think the program is different than a lot of others out there. It is truly co-creative. It's designed to fit to your needs rather than you having to jump through a bunch of arbitrary hoops. By far, it is the most comprehensive offering I've ever put together. And if you register before October 1st, you can get 50% off. To learn more about the program and register, go to jbrownyoga.com/training. That's jbrownyoga.com/training. All right, you've done it. You've chosen to listen, and here we are. This is Jay Brown Yoga Talks podcast. My name is Jay Brown. Welcome to you, new person, returning friend, whoever you are. I appreciate you being here. How are we feeling today? That is the question, my friends. How are we feeling? If you've been around long enough, you know in the early days of the show, pain was an ongoing topic. I was interested in having some pain science people on. I was having all kinds of pain issues in my own body. I was wanting to admit to that, like publicly, and expose the fact that so many yoga teachers I knew were experiencing all kinds of pain and kind of putting on a show when they went to teach their classes and not letting everyone know how much pain they were in. And, you know, over the years, I think I did a much better job of addressing my pain. And part of that was moving from Brooklyn and changing my lifestyle, really. And I think also a range of other choices that I was making, even in terms of what I was eating and definitely how I was practicing my asana. And, you know, up until pretty recently, I've been feeling pretty good. I haven't had any major flare-ups. I feel like I've been managing my pain issues pretty well, all things considered. But about 2 weeks ago, my hip flared up again. And it flared up in a way that's like, I don't know, feels a little different than usual, and it seems like my tools, my existing protocols, they don't seem to work as good as they once did, and that makes me feel concerned. When that happens, when the things that I normally do to address something don't seem to be addressing it as they once did, then I feel like I want some new information. I want to see if I can expand some awareness or some understanding or some skill set so that I might better address it. And often that involves reaching out to people who have information that is helpful, that points me in certain directions or helps me hold certain ideas about me and my health and my body, or about how to address it. And I've been talking to people like that here on this show since the beginning, and I think today is in that long tradition. My guest is Libby Hinsley, and Libby has a book that she put out recently called Yoga for Bendy People. And more specifically, it's about hypermobility spectrum disorder and other hypermobility syndromes. And if you don't know what that is specifically, I didn't really either necessarily. I mean, as yoga teachers, I imagine most of us have heard the term hypermobility before. You know, those are the people whose elbows goes past straight. Those are the bendy people, as she was saying in her title. But what Libby discovered and what I learned is that, you know, there might be a lot more to it than just an alignment cue. That in fact, for some folks who do have that kind of hypermobility, it's often a systemic thing that's going on and can be expressing in lots of different ways. And knowing about that and knowing it as a systemic thing, in any case, I don't want to give away too much. I don't want to spoil too much, but I certainly gained some new perspective from reading her book and having this conversation with her. And I think it's going to be relevant to a lot of you out there. So I'm very glad to be sharing it with you today. And as I said, I have had this like pain thing flare up, but maybe we'll have more of a check-in on the state of my hip on the other side after we listen to this conversation with Libby. Before we get to that, though, I do want to take a moment to express some gratitude to our podcast premium subscribers. Specifically today, I want to say thank you to Kyle Cruikshank and Andrew Bauer. Shout out to you, Kyle and Andrew. Thank you so much. If you appreciate the show and you want to support it, or you want to get access to the full archives, the way that you do that is become a podcast premium subscriber. It's choose your rate, cancel at any time. If you don't have any money right now and you want to get to an old episode, just email us and we will definitely give you a free account. But if you have even just a little something to give, it's really how we keep this show going, and we are incredibly grateful to the people who are doing that. To learn more about becoming a podcast premium subscriber or find any of my ongoing stuff, everything can be found at jbrownyoga.com. Okay, like I said, we will have a check-in on the other side if you want to stick around. But for now, let's go ahead and get to it. Let's listen to this conversation that I had with Libby Hinsley. Hello?
Hello.
There you are. Hi.
Hi, it's nice to meet you.
Hi, nice to meet you. I think we may have kind of been in the same room before in passing, like at the Breathing Project many years ago, perhaps. I seem to have a vague memory, or I might be confusing you with someone else. But either way, good to meet you now today.
Yeah, likewise.
And there was a real confluence of events that brings us together. It's often the case on the show. And I am already recording. I don't know if you listen to the show. I like to consider us having just begun, if that's okay with you.
Great.
And, you know, as often these days with episodes, there's just like a series of coincidences or things that are relevant to my own immediate experience that bring these about. And that absolutely happened in this instance with you. And this is stuff that you don't know. So I'm going to fill you in a little bit.
Sure.
And it'll be for anybody else listening too. I think this is kind of the context for our conversation today.
Okay.
So, you know, I would say first, the background is I've been kind of managing chronic pain in my body for more than 20 years. You know, I always just call it chronic inflammation pain. You know, I don't know what to call it. Mm-hmm. And I've developed a whole range of tools and skills to kind of manage that. And I think I've done that reasonably well over the years. I've learned a lot of things. Many of the things I came to, you wrote about in your book, which we'll get to. Oh. And I think a lot of the teaching I do came out of me sorting things out in my own system. And the reason I changed and moved to like a gentle approach and all this stuff had a lot to do with that. Yeah. I would say I have pain in a lot of different places in my body, but one place in particular is my hip has been kind of like a chronic, like even sometimes when pain will show up in other places, like in my spine, like my pain in my hip will go away for periods of time when there's pain in a different place in my body. But then when that settles down, the pain in the hip comes right back like it was. And, maybe a few years ago, it flared up really bad, like worse than it had in the past. And I always said, if it ever got to a point where it was like really getting debilitating, I will go seek help. I know too many yoga teachers who had hip surgeries and got like new leases on life.
Yeah.
For me to be so stupid as to not at some point go seek some help in this regard.
Yep.
But like a few years ago when it flared up kind of worse than I ever remember it flaring up, I got up the gumption to go to a doctor. And it was very vulnerable, like to go to the doctor, admit that I've had this pain for a long time and ask for help. And let's just say, in my opinion, he wasn't a very good doctor because he just didn't seem to recognize what it was for me to be even doing this, and I tried to kind of clue him in, but in any case, he took some x-rays on my lumbar spine and my hip. And then a couple of days later, I got a call from the nurse and she said the doctor didn't see anything in the x-rays. And it was kind of like, that's it.
That's it.
And I felt like I was going to have to like plead or beg or persuade to try to like find out more or do more with that doctor. So I just never did. And I actually do have a doctor now for the first time in my life who I actually really feel like I could work with. She was a yoga teacher before she became a doctor, as a matter of fact.
Yeah.
And 2 weeks ago, I kind of had a flare up recently. I said to my wife, I said, you know what? I'm going to go and try and get a diagnosis and see if I can find out what's been going on with my hip all these years. And then within a few days of saying that to my wife, I caught up on Leslie Kaminoff's new show, Clinician's Corner, of which you are the first episode. And anybody listening to this, I do recommend going to listen to Leslie's new show. It's really great. And I recommend getting the premium and watching the second half too, because that's a really significant where you get to see people actually doing their practice and stuff.
Yeah.
So in any case, I'm listening to you talk about hypermobility syndromes. And I think that a lot of yoga teachers listening to this, and I'm putting myself in the same boat, we've all heard about hypermobility before, like don't hyperextend your elbows in down dog or whatever. Like it's about an alignment instruction for the Bendy People. Your book's called Yoga for Bendy People.
Yeah.
And, hypermobility is like a different alignment instruction for them or something.
Right.
And now you're talking about hypermobility syndromes and disorders and how much that's like actually kind of a condition that would affect someone's whole system. Yeah. And then I'm watching the second half of the premium and you're doing, what is it? What's it called? The Vitan scale to like assessment.
Yeah.
I got like a 7 out of 9 on that.
That's a pretty high score.
And you were like anything over 4. And I was like, okay, I just got a 7. So in anyways, this may be a long-winded way to kind of clue you into, I'm getting ready to go see my doctor to talk to her. And I feel like I have new information that's really valuable and that is not readily known. And I thank you for that. And I think it's a significant contribution you're making in this regard.
Thank you. I'm so glad you found it helpful already.
Just to idea of okay, maybe it isn't just my hip. I have a theory that it could be something labral, but I don't know. But it could be something just more on a bigger systemic level. So before we get into kind of some of this syndromes, I'm just kind of curious, when did you first hear about hypermobility syndromes? And when did that become something for you where oh my God, this is a thing. How come I didn't know about this?
Right. Well, it's a great question. I have to kind of look back at my entire life because I have always been very obviously hypermobile. So as a little kid, I did gymnastics and I was super bendy. And, very successful at gymnastics. And I also started having kind of weird injuries that my peers weren't having. After gymnastics, I got really into tennis. I was a competitive tennis player through college. So for many, many years, I lived at PT for my shoulders. My shoulders were just shredded up all the time. And it was always really known, oh, well, you just have hypermobility. Your joints are double jointed and all that kind of stuff. But that's pretty much where it ended. And then fast forward into my, entry into yoga in my 20s in college and beyond. And I was very successful at yoga because I could do all the difficult things. But I also started developing chronic pain in my early 20s. Head to toe. It would move around, and it was here one day and there the next week, and, pretty debilitating muscle spasms where I couldn't turn my head for a couple of weeks at a time. It was really weird stuff. And I went to all kinds of different people, and there was never anything wrong. I had MRIs, I had x-rays, I had all the things, and everything was always normal, but I was really in a lot of pain.
It seems like sometimes you're trying to find, what did I do to make that pain happen? And sometimes it doesn't seem like there's I didn't do something physically today that strained my body that made that pain show up tomorrow. It just shows up.
Exactly. And that's one of the things that gets so confusing about pain versus injury, tissue damage versus pain. They're different things. And, I always tell people, if you to sustain an injury and damage your tissues, there actually has to be a mechanism of injury. You don't just, it doesn't just show up. You don't just tear something, usually it would be really rare. But pain is a different story, and sometimes points to a bigger systemic situation with the nervous system and sensitivity and all that. So anyway, I got, a lot of pain in my yoga practice. And at that time, I was still really under the influence of, it must be an alignment problem. I just need to work harder, probably do more yoga, probably work on my alignment more and get it more correct, and that was sort of the yoga world I was living in at that time. And then, I became a yoga teacher. And then I went to PT school about 6 years after I'd started teaching yoga. And I just got interested in PT because of all my students' injuries, but also because of my chronic pain that and challenges that were, largely musculoskeletal. But on the side, I also had all these other weird things that turns out are related to hypermobility that I just never connected. Unfortunately, I did not learn much about hypermobility syndromes in PT school. That's a bummer, because where do bendy people hang out? At PT. And so
And where would bendy people go for help? They go to PTs a lot of times. And if they don't know about it, who does?
Exactly. So it's a really big problem. I would have never, ever guessed that I had Ehlers-Danlos syndrome, which I do have, hypermobile Ehlers-Danlos syndrome. It's a connective tissue disorder that causes hypermobility and a whole slew of other things. So based on what I learned in PT school, I never would have thought that was me. So there's an education gap that's ginormous among all medical practitioners. So I really got clued in to the level of how this was impacting me. Really, in the last 10 years, I've started my own PT practice, incorporating kind of yoga modalities and different things. And I started treating a lot of injured and in pain yoga people, teachers, practitioners. They were all bendy. So I started seeing these patterns they were just like me. They had the same sorts of chronic musculoskeletal complaints. They also had anxiety and sleep problems and digestive weird stuff and all these restrictive diets and sort of a propensity for systemic inflammation and autoimmunity and this whole cluster of things, right? And I was like, dang, this is very interesting. And so it kind of got me on that train of really learning more about hypermobility syndromes and its overlap with chronic pain, which I was also studying a lot, the neuroscience of chronic pain. And I was like, whoa, I think that I might have this, as I started learning more. So I didn't get diagnosed until about 3 years ago, which is it's like kind of like what you were mentioning before. You've been through this 20 years dealing with this thing, and then finally you try to go seek help, 20 years in. And it's really hard to describe to your doctor all the things you've been through before you got there. And that's kind of like me. I'm like, okay, I've been a yoga teacher for all these years. I'm actually a physical therapist. And all of a sudden, this hitting me over the head that I actually have this disorder that explains my entire, past 20 or 30 years of my life.
Wow. So these hypermobility syndromes, they're on the books. Like, we know about them already?
Yes, technically. The problem is a lot of doctors just don't know about them. And it's an education gap, but I think here's why. It's because they're not well understood, and especially because they don't really fit into any medical specialty. Because when it comes right down to it, these are disorders of collagen, of connective tissue, essentially, if we boil it down. And that doesn't belong to any medical specialty. There isn't a place that's clear where you should go, because it shows up as a really multi-system disorder. You may be sent to a whole slew of specialists for your symptoms related to these syndromes. But the specialist, it's like all the people trying to figure out what the elephant is, the blindfolded people touching one part of the elephant. They're right. Seeing it from their little slice of the pie, and they don't see the bigger picture. And so what happens is they do their little specialty specific assessment and testing. Looks like everything's normal. I don't know what to tell you. I have no idea. And when a doctor doesn't have any idea what's wrong with you, it's very easy for them to fall into an unfortunately dismissive kind of way of being that doesn't really validate your experience. And I don't think it's intentional in a lot of cases. It's a weird scenario when a doctor doesn't have anything to offer you, right? It's weird to them as well. And so their default is, it's probably just anxiety and stress and
right. I think the good ones know how to handle that moment better.
They do. And there are plenty of good ones.
In a way, because I just need honesty. Yeah. I don't know. I think that other doctor was just another story. I guess my curiosity then is, all right, then, so how, and this comes to what I said earlier, how do you distinguish between just someone who has a hypermobile joint and like a hypermobility syndrome? What is it that, how do you diagnose that? What are the things that go into making that diagnosis?
Yeah, so there are a lot of different things. And so hypermobility by itself is not pathological. If someone has a joint or multiple joints that basically demonstrate a more than normal range of motion, that's hypermobility. It's a descriptive term. But when it is symptomatic, that's when we get clued into, okay, maybe there's more going on, and maybe this hypermobility is actually caused by an underlying genetic difference in the way that this body creates collagen and the way that the cells within connective tissue, the little fibroblasts, the way they behave and do or don't do their job very well. And so, because then we are more likely to end up with symptomology that's musculoskeletal, but that's also psychiatric, digestive. It's all these different systems involved. And that's when you can start connecting those dots and say, oh, this looks like a hypermobility syndrome. So really the best way to describe that is symptomatic hypermobility. Now, how do we diagnose those? Well, there are two most common hypermobility syndromes. One is hypermobile Ehlers-Danlos syndrome, which I have, and the other is hypermobility spectrum disorder. And these are kind of complicated diagnoses. And what's most important for listeners, I think, to know is they're essentially the same thing from a clinical perspective. The Ehlers-Danlos syndromes, there are 14 subtypes. All of them are genetic connective tissue disorders. And 13 of them have really clear molecular markers identified. So you can have a blood test and test for them and say, oh, yes, you have vascular EDS or classical type EDS. But the hypermobile type, which is the most common type, does not have that yet. So it's not well understood from a genetic perspective. And so someone who has that is diagnosed by this long list of just clinical signs and symptoms. And so if you check enough of those boxes, you qualify for that diagnosis. But let's say you or someone else has symptomatic hypermobility. You've had this chronic pain. Maybe you dislocate or subluxate your joints. Maybe you have all these other kind of immune system issues, mental health issues, digestive issues. But you don't qualify for that diagnostic label, the hypermobile EDS, because you don't check enough of those boxes. but it looks a lot like that. Well, the other label we give to that is hypermobility spectrum disorder. It's basically like a bigger umbrella.
If you have enough of the boxes checked that you're not just, there's definitely something going on, but not enough to have the EDS diagnosis.
Exactly. And here's what's really funny about all those boxes is they're totally up for revision again. They were revised in 2017 and they're going through another revision now because it's such a moving target. So kind of researchers are trying to figure out how do we capture this group of people who clearly has some type of EDS, but we can't really identify what's going on genetically yet. So it's an interesting and evolving field, really. And I think we're going to learn a ton more about this in the next even few years.
So did I understand correctly what you just said, that there's EDS that has nothing to do with hypermobility?
Well, not exactly, because all the types of EDS have hypermobility as a feature.
I see.
And so just as another layer of confusion, this one type that's the most common is called hypermobile EDS, when actually
they all have hypermobility. They just call it that. I get it.
Exactly. Well, it's almost like we couldn't really make this more confusing if we tried.
I see. But you said that there is a bunch of types, 13 out of 14, that you can go get a blood test for. So you just have to request that specific test, I imagine. You
have to, and has to be a reason, for someone to refer you for genetic testing. And those other types are quite rare. That's the other thing. So hypermobile type is thought to be anywhere from 1 in 500. Some people place it even higher than that. It's hard to pin down the prevalence because it's so poorly diagnosed. So it really is hard to say how prevalent it is, but it is by far more common than the other types. So it would be, the other types are going to show up with likely more significant issues that are kind of bigger red flags for people. They're more life-threatening complications involved with them, and they're far more rare. So I don't know if the other types are missed as often as the hypermobile type.
Right. Because you'd be like, the symptoms would be more severe for those types, as I guess what you're saying. They would be.
They usually are. Like for the classical EDS, like the skin issues for that type are much more severe than, say, for the hypermobile type. Hypermobile EDS people, they might bruise easily. They have a little bit of extra skin extensibility. Like I can pull my forearm skin like way up. If I didn't have the shirt on, things like that. But the classical EDS, their skin issues are more pronounced. So they could pull their skin way out. Like it's just wild. And they'll bruise really easily, very soft skin, often really can't handle any adhesive. They can't tolerate taping or anything like that. So that's what I've noticed, for just as an example. I have a patient who has classical EDS and he's got all those skin issues, but he also just had multiple recurrent dislocations as a kid, which just was not normal stuff. And so that caught people's eye.
Got you. So do I also understand that these hypermobility syndromes, they have to do with, I think you said collagen, right? Like the way the body produces or handles collagen. Can you say a little bit more about that, like the specific of what's affected in the body?
Yes, there are a lot of different kinds of collagen. And collagen, we could really consider the glue that holds your parts together, all of your parts.
I always just think of it like the nose, right? That's what's in my nose, right? I don't have a bone in my nose. That's the collagen right there.
It's all collagen. And there are many, many types of collagen, something like 20 or 30 different types. And the genes that code for the, assembly and everything of collagen are many, many. So it's very complicated, this whole bit of collagen. Well, collagen makes up a lot of different things in the body. It's part of your bones, it's part of your gut lining and your blood vessel lining, but especially it's very it makes up your connective tissue. I mean, when we're dealing with movement and stuff like that, it's most relevant to talk about connective tissue, collagen-rich connective tissue like tendons, ligaments, joint capsules, fascia. It's full of collagen. It's the most abundant structural protein in the body. And so those tissues are full of collagen. And what collagen's job really is, essentially, is to resist tensile loading. It's to withstand stretch, basically, whether that stretch, comes from gravity or from a yoga pose or whatever it is. Its job is to be like a steel cable that's resisting you being pulled apart. It's, for example, we've got all these skin ligaments, tiny little skin ligaments holding our skin on. And, I always think if you're just in gravity, the reason our skin isn't just falling off is because those collagen fibers and those little tiny ligaments, it's like sticking you together. And so we want that steel cable-like property of collagen. And when people have these hypermobility syndromes, they have a defect in some form of collagen that causes those tissues to be less like steel cables and more like taffy, like more floppy. The term is
floppy bodies. You said that in your book. I've been saying that for years. It's more floppy. That's right.
More floppy. And the term is really laxity, and if we talked about it from a tissue behavior, mechanical behavior standpoint, we could say this person's connective tissue, when you pull on it, when you stretch it, it is going to give more easily. It's going to yield more, and it's going to kind of bounce back more slowly after that long stretch. Let's say if we apply, a long passive stretch to connective tissue, we can expect it to yield after a few minutes, and then we can expect a recoil coming back to its resting length. But with a floppy body, floppy connective tissue, it goes further quicker and it takes longer to come back. It's more taffy-like. If that helps describe it.
It does. And there's sort of like implications to that in your body, which we can also talk about. But I guess before we get to that, I'm curious. I also read something about dental history, which is kind of random. What does dental history have to do with it? Because I have had all kinds of dental work done too. And I'm like, does that connect to this too?
It does. It sure does. And it's so weird. And there's so many things that connect to hypermobility syndromes. And it could be easy to then start blaming absolutely every single problem you've ever had on the hypermobility. So it's kind of a slippery slope.
You want an answer to it all. You want like one answer to everything, right?
Well, and I would say that for many people, myself included, the hypermobility syndrome absolutely does become the unifying principle for everything. It's why everything starts to make sense. Things that haven't ever before. So the dental issues, one of the diagnostic criteria actually for hypermobile EDS is some dental history stuff. So usually there's a high palate and a very crowded mouth. So most people, like myself included, I had to have a ton of teeth pulled when I was a kid, 8 teeth. 4 baby teeth, then 4 big teeth, because there wasn't room for them in my mouth. Now, these days, it wouldn't be so barbaric, probably. They'd probably do some different things to try to widen my palate, make some room, so I didn't have to lose so many teeth, because, of course, now we know losing teeth actually affects the shape of your whole head and face and isn't awesome. But anyway, that's what they used to do that more. So crowded teeth, high palate, lots of braces and things like that to straighten things out is very typical.
Interesting. All right. The other question I kind of think was significant that you put in your book that I wanted to talk about before we start to talk about like ways to deal with it potentially, like this question of mobility versus flexibility, because it's a conversation among yoga teachers for many years. I started using mobility as a choice of words a lot of times in certain contexts instead of flexibility. So maybe just since we're getting such a good lesson today on some of this, like we're going to fill some of the educational gap, maybe we could take a moment to distinguish between mobility and flexibility also.
Okay, so I'll give you the way that I use these terms, and I try to be consistent in my use of them with the hypermobility world, the research on hypermobility and the experts that are talking about hypermobility. But I will say they're not always used this way, and that confuses things. And
it's the case with a lot of like these nuanced kind of topics or conversations. We're trying to find words for things, and sometimes people ascribe different meaning to the same word, and then it's hard to be talking about the same thing.
Exactly. It is. There's a lot of time. So just know there's a, bit of a semantic, debate out in the world about what's the right thing to say here and what are the right terms. Okay.
Duly noted.
Okay. But we're always talking about range of motion. What kind of range of motion is someone demonstrating in their joints? And when I say flexibility, I'm talking about movement that is granted based on the muscular system, talking specifically about muscles, which are under the control of the nervous system. So we're talking about how well can your body use, like actively use, and move itself through your available range of motion that your joints have the capacity for. And that has to do with, well, how flexible are your muscles? How well do they relax? And how well do they contract? Are they hypertonic? Are they chronically contracted, even to the point where they're actually limiting your range of motion? Right? That's a case of inflexibility, and counterintuitively sometimes shows up in bendy people because their muscles are chronically contracting all the time to compensate for their joint mobility. So when I say mobility, I'm talking about what's going on at the joints due to the collagenous connective tissue around them. What are the joint capsules and the ligaments that hold the bones together, the joint? What are those tissues allowing to happen at the joint?
Right. So it's in the muscles or it's in the connections?
Basically, yeah.
Gotcha.
And certainly these things, we can't separate them when we're really visualizing someone's movement. I mean, I could move someone passively. If I really wanted to get a sense of what's the joint mobility here, I would need to move their limb passively to just see what is actually available. And then when they do it actively or move themselves through it, we're going to see something different.
Right. You'll see what.
And that's why as a yoga teacher, it can be so confusing and so difficult to watch your students move and to make sense of what you're seeing. It's very difficult.
It can be. And that's why, and we'll get to this more too, it seemed like the key is whoever that person is with the syndrome, they're going to need to be developing some barometers for themselves in a lot of things, it seems like. But first, before we get to that, I keep putting it off because I did have another question about, is there like formal protocols for this diagnosis? If I go to the doctor and the doctor does determine that I qualify for whether it's a EDS or non-EDS hypermobility syndrome diagnosis, are there like surgeries and medications that they have that they're gonna offer? Is there something that they have to prescribe?
Not really.
Yeah.
Not really. What they have to offer is a diagnosis. And I think that is super critical because for someone who's had weird stuff that they haven't been able to understand for 20 years, having a way to understand it is unbelievably helpful. It is freeing because when you understand what's going on, you're not scared of it anymore. So in my mind, diagnosis frees people up to not be afraid of their pain and their circumstance, and then to go ahead and learn about it so they can manage it and live better with it. And now for some people, they may have pretty significant like immune system issues with their mast cells that release histamines, and people have a lot of histamine issues. There are mast cell stabilizing medications, for example, so that could be a thing that might be warranted. There may be some reason to explore some medications for chronic pain. Like I know there's some novel approaches using low dose or even ultra low dose naltrexone, for example, which works differently at very low doses. And it's kind of a new medication, newish use of that medication to address chronic pain. So there may be some medical interventions that make sense for people, but it's typically management. And so where will you be sent to learn management skills? Physical therapy. Does your PT know about these? I don't know.
We already talked about that. You didn't. You were a PT. You didn't know.
I didn't know about it, and I had it. So it can be hard to find people who really can give you guidance. There going to be guidance on self-care and movement and activity. There may be guidance on nutritional and supplemental nutrition to support things.
Yeah, I just think that's a significant thing for me to understand, that going to the doctor to get the diagnosis is a helpful thing, but you can't go in there with the expectation that the doctor's actually going to know what to do about it. Because I think sometimes we would expect that the person who's equipped to diagnose us would also be equipped to treat it. And what I hear is it's still going to be on me to have to, deal with it. But the information, don't get me wrong, that's why I'm going to go to my doctor, even just to see if something does come up in a test, if there is some actual damage that could be seen or whatever, just to find out, I think is useful. If it's done in a way that's empowering, though, because I get worried, because sometimes once you get into that system, like sometimes the diagnosis seems to take away agency rather than give it.
I know.
I hear you talking about it giving agency, but sometimes it seems like it takes it away.
It does. It's going to do one or the other. And, I see it all the time. Also in my clinical practice, I had a patient yesterday who was really striking in kind of taking the diagnosis in the other direction. And so there's going to be a lot of education about revising the self-concept about what does this mean to have this diagnosis? Does it mean that I have an excuse and I have to say, I'm not able to do that activity or that one, and I'm just going to make my world smaller and smaller and smaller and smaller and lose capacity because of this mentality of, how I'm seeing myself? Or am I going to say, oh, cool, now I get to learn about my unique body and my unique nervous system, and I get to learn tools to manage it so that I actually feel better. And I'm going to just really take the reins on what we really know about tissue adaptation, even in bendy people, that the only way that my tissue is going to get stronger and build more capacity to support my body is by challenging it. That is the key.
Okay, I want to talk about that. But wait, before we talk about challenging it, I mentioned that just out of my own somatic inquiry, I guess you could say, I met this teacher, frankly, in India, who was like my first teacher, who his main question was, how do you feel? Mm-hmm. Just ask yourself, how do you feel? And I didn't know. I mean, I could do all the stuff like you said. I was like an advanced practitioner because I could do all the stuff, but I had all this pain, and I thought that was opening, because in the yoga world that we inhabited back when they were telling you that it was just about alignment, pain was opening. And I just thought everything was opening.
Yeah.
And then when this person started asking me, how do you feel? It was like, okay, well, I feel like shit. And then it became about, what are the things that are helping how I feel? And what are the things that I'm doing that are not helping how I feel? And I just gave myself permission to, if I can't find a good reason for it, or it's not helping me feel better, I'm just not going to do it anymore, even if that's what all the teachers were teaching.
Yes.
And I found Desikachar teachings and personal practice as a vehicle really to suss that out.
Yeah.
And the main thing that I discovered initially, which is what I wanted to get to, which I think you might be able to speak to, is that initially I just thought I'm fatigued. I'm not necessarily even tired, I didn't sleep enough, but I feel fatigue in my body. And I needed to just literally, if I just laid still for periods of time, it would feel like the kind of inflammation would go down and my body would settle. And it's kind of like you're saying, I needed more recovery time than other people. And I remember having these conversations with my wife, because she comes from a military family, and lying around and not doing anything is considered lazy. And I'm like, no, I have to do this so I can feel okay to teach all my classes, But it seemed like that was a big thing. I just needed to rest more. And from what I understand, that kind of goes in line with some of these syndromes. Is that right?
Definitely. Absolutely. It's very common for people to have what looks like chronic fatigue, or just what is chronic fatigue syndrome. A lot of people have that, or they just have never felt like they could quite keep up with their peers. They're just more tired. They need more rest. They don't recover as well, even though they're healthier. They eat super healthy because they have to, because that's part of how they've already learned to manage themselves. And they're like, why am I just eating super tip top? I'm taking really good care of myself. And yet,
if you are hearing this message, then you're listening to the free version of Jay Brown Yoga Talks. To hear the rest of our conversation, please subscribe to Podcast Premium at jbrownyoga.com/premium.